Good afternoon. Today we have our Chief Executive Officer, Marvin Ventrell, and we have the Director of Research and Education, Dr. Annie Peters. Thank you both for being on here. Marvin, we wanted to start off to address some questions that our membership has had and community at large. How do you think that COVID-19 has impacted the field and then has impacted the population that we serve?
Sure. Well, hi, everybody. I'm glad that we have an opportunity to do this. I was thinking as Nikki was getting started that virtual services, as we see them increase in our field and try to respond to them, there are pros and cons, but I'm glad today that we have these services here at NAATP. We can reach out to our membership. We're doing that, and it's really nice to have the technology. It will be even better when we can get together in person, but I'm glad to be able to do it this way. This is profound. To state the obvious, what has happened in our world and in our treatment environment, if there's a bigger word than profound, we should use that. There's no way to overstate how big a deal this is. I can't compare it to another big deal. The employment numbers came out today, and I think we're close to 15% in national unemployment in this country. Those are Great Depression numbers, and the idea that the economic impact of our country could resemble those days was unthinkable. Our job is to try to anticipate trends. It's going to depend on a couple of things. How widespread is this? Does it recur? There are a number of science COVID disease factors that we have yet to learn in order to determine how it trickles to everything, including us, but it's massive. And we're seeing tremendous impact on our providers. They're amazing providers. NAATP members represent about 1,000 treatment facilities in the country, and they're the best. And so, we're seeing a good response, but it's been tough. Those centers that recognized what was coming, like this is not going to be small, and got out in front of this in terms of moderating their expenditures and really being able to anticipate patients coming in with an issue so that right away, to the extent that testing is available now, even residential programs are able to respond and treat safely. So I guess I'll say more about the field. That's what we do here. But I talk about the population first, the population that we serve, which is really the first point of order that I would address. And the impact on the population is profound in a couple of ways. Addiction is a disease of isolation. It's fueled by isolation. It in and of itself creates more isolation. So the response needs to be community, it needs to be contact, it needs to be coming together. And so its fundamental need is interrupted to a large extent simply by virtue of this happening. So those who are in recovery have less. Those who are prone to become in need of treatment and recovery in our world have less. And here's the kicker. We're going to create a new population of substance use disorder people. We think sociologically about what happens to people in crisis. And these are people who might not otherwise develop substance use disorder. I believe that we're going to see a new population that we would not have seen. So it actually has the potential, I hope I'm wrong, to give us a new population of people who need care. So the pandemic did not get rid of our other national healthcare crisis, addiction, right? We're talking about 25 million people in this country. No one is suggesting that we not address this, but we had a national crisis before COVID. And the fact that we see COVID doesn't mean that national crisis has gone anywhere. To the contrary, it's expedited. And so we need to take care of our people in a bigger and better way than we ever have before, with fewer resources, but a more difficult opportunity to respond. I should end this portion with, I'm seeing tremendous response from our providers. We're getting assistance. Hope we need a lot more from the federal government, but it's not that we can't do this. We can do this together, but it's bad.
Thank you, Marvin. I think that was extremely informative, and you hit a number of different points. Dr. Peters, do you have some questions for Marvin?
I do. Thank you, Nikki. So Marvin, thank you for that description. I was listening and feeling the impact that this has had. So What has NAATP done in response to this crisis, and how we're trying to support our members, and what sorts of activities we've been up to?
Thanks, Annie. The good news is the primary themes of NAATP's work don't change. They're accelerated, they're exacerbated, but they don't change. So, for example, education and training, a cornerstone of our work, doesn't go anywhere. The need for it becomes greater. Research on a scientific level that we've engaged in a significant way doesn't go away. It gets more critical, especially as we add, a virtual climate and have to figure out how that works and doesn't work. Look, I think that we're going to learn that virtual care has greater efficacy than some are willing to give it, but we're also going to learn that it has limitations and deficiencies. The key, it seems to me at this point, is to get the research done that allows us to understand that the decisions as to diagnosis and treatment plan must be based on clinical criteria, not just payment criteria, not just availability. So we talk about the ASM criteria and others. That's got to be the determination. And so when the determination is virtual, great. When it's not, we need to make that decision correctly. So what we have done is, double down. And then the third piece, or third prong, if you will, of our work is policy advocacy, especially on the national level. So our work on the Hill in Washington, D.C. is always active, but it's doubled down as well. Our public policy director in Washington, Mark Dunn, is doing a fabulous job. NAATP was instrumental in the payroll protection program access for our people. We're working hard on the next phase of legislation to the extent of the $38.5 billion number, the behavioral health influx in which our world occurs. So what we have done is ask ourselves, are these the right things? Yes. And how do we increase them relative to this response? So I would highlight for sure the public policy work right now. Look, this field needs a trade association. This field needs a collective community voice. It can't be 1,000 weak voices. It has to be a collective, powerful voice. And so that's the purpose of NAATP. That's the purpose of a trade association, and we need it now more than ever. And so we're working to give our members what they need, but also to communicate to everybody, we got to keep this going here. Because as we make cuts, we can't lose this. We can't lose the collective voice. So the advocacy piece is profound. We've also stepped up our communication level, right? So we have the weekly webinars that are COVID-based. How do we respond relative to leadership, relative to clinical practices, relative to operational business practices? And so I hope all of our members are accessing our special COVID page that has all of those resources. Our teams of members come together and help each other. That's a beautiful thing about crisis, is when we see those people come together and help each other and share information. And that's just been amazing. Our members are not stingy or territorial with what they're doing, and they're learning and they're helping each other. And we're a communication hub for that. That piece has been critical. So I hope folks are taking advantage of those things as we do that. And then the research piece sounds high and mighty right now. It's like, okay, you're going to engage in long-term, in-depth scientific research. That's what you're focused on right now. But yes, I mean, crisis is a time both for a little bit of retrenchment in terms of expenditures and those kinds of things, but it's also a time to look at opportunity to invest, right? It's an investment time too. We need to invest in what we need to know, which is what treatments work for what populations under what circumstances. So I'm telling you, Andy, this is your job, but those are the things we're focused on.
Thank you, Marvin. And you mentioned the resource page that we have, naatp.org, and just a plug for the COVID-19 Impact on Addiction Treatment survey that we have on there that is really geared toward finding out what the impact both of COVID-19 and of the transition to telehealth is having on people with substance use disorders. So that's one way in which we are doing that, collecting some data to look at where do we go from here. And that leads me to my next question, which is, where do we go from here?
Yeah, So a crystal ball we do not have. That sort of prognosticating is destined to be flawed, but that doesn't mean we can't engage in it. So we have to take the best information we have and try to predict. So here are some trends that we're seeing with our providers that help us predict how to respond. You know, how we respond depends on what we think the future is going to look like. What we think the future is going to look like is going to depend on impacts, some of which we can't anticipate. But here are two things that I think the future we should predict as increased or even new. One of which is recovery services has grown in the concept of recovery capital, right, in recent decades. We get that people do better the more recovery capital that they have. We need to give them wraparound services. It's not just this isolated service. And so that's good. But you know what this looks like? If the economic downturn is as devastating as it might be, especially for people who have less, substance use disorder treatment needs to encompass life survival. I mean, we need to be thinking about things like addiction treatment providers encompassing food and shelter in their services. That's not really how we've thought about that before. So life services predictably is going to be increased. And the other thing is science. Science is going to take on even greater meaning. So here's what we're learning, I hope, is that scientists are necessary. Scientists are our saviors in this process. And so we highlight now and understand that science is even more important than we might understand. But that's going to be even more true as we go forward.
Thank you, Marvin. So what I heard you saying there is that both community and science are two things that we have to build. And as we do one, we do the other, and we find out how to keep going and how to always learn more and always get better.
Yeah, I hope that's what I said. And so, the other piece is, as we look at global big picture issues, which I love to talk about, we also have to look at the day-to-day operational practices that keep the doors open, right? Our message to our centers is stay open and stay safe. Well, thanks, NAATP. How do we do that? Well, that's what the resources are for, but here's what we see. First of all, there's still not enough treatment. I mean, we all know that, not by a large margin, but there are a lot of centers out there. Some of them are closing. Some of them are thriving. That's probably, I think on the margins, closing and thriving are probably the minority margins and everybody else is in between. But we see centers who are historically sound, who don't need to rely just on a Google hit or international or national flights in for their client population, because censuses tanked. Censuses tanked in April, and with good programs, many programs, we're seeing censuses come up now. So that's the good news. But that depends on how operationally sound the treatment program is. So real marginal centers with inadequate profit margin are in tremendous jeopardy, and we're seeing those close. Centers that anticipated the digital culture before this ever happened are doing better. Centers that did not begin to see that, it's like the Blockbuster model. At some point, people are going to stop using that little machine. Now, residential care will never be inappropriate. It's going to be appropriate based on clinical criteria. But to the extent that those centers have that scale, so low scale, high risk of failure scale, relatively speaking, a better risk of success. The other thing that we're seeing is, look, there's been a mergers and acquisitions industry consolidation trend now for many years. It just got bumped up. It just got accelerated. So again, this theme of the stuff that existed, especially if it existed a little bit quietly, is now no longer existing quietly. So we're seeing that consolidation accelerated. So centers that are strong and large and capable of acquiring are going to acquire more. That's the business model in this time. That's not all good or all bad, but it just is. And so, we're going to see closures and we're going to see consolidation in a way. And so when we think about what's going to happen going forward, that's a big piece of it.
Thank you very much for that, Marvin. One thing that I wanted to add is you had so eloquently put that NAATP is its members. And I think that that is a very important message, that everything that we're doing is to support and to help our members. And so one of the things that I wanted to say is that at the end of this, we will be putting up a slide with our contact information, and we want to hear from you. We want to know how we can help. We want to know how we can encourage and support. And so whatever it is that we can do, please do not hesitate to reach out to us to let us know. And with that, Marvin or Dr. Peters, is there anything else that you would like to say to close us out?
I would say to those of you who are service providers, we get it. We're with you. We want to be with you. We want to answer your questions. We want you to come to us. We want you to know that you're not alone. Our members, as Nikki said, are the association. So yes, contact us, go through our systems and get direct resources, but we are we, right? And so it's your colleague that's another NAATP member who, and the way we connect those with our programs, for example, that in some ways are going to be the best support you've ever had. You're not alone. Right? I mean, that's the hardest thing about anything is like, it's addiction. That's right. What do you think when you're suffering from addiction? You're the only person in the world that has this, and you don't understand it. And nobody understands me. And then you learn through the recovery process, I'm not alone, and help is on the way. There is a solution. So that's what I want people to know.
Yeah.
Dr.
I would
Peters?
just add a thank you. Our members are doing such important work, and thank you for what you're doing every day, whether you're a leader or a counselor or a nurse or a support person, or it's so important that you're out there doing this work, and thank you for all that you do.